Thank you, Dr. Marks, for joining us. Right now, we are seeing an increase in many parts of the United States of more people being diagnosed with the coronavirus. And along with that, we're seeing an increase in the need for convalescent plasma. Why is there such a demand right now for convalescent plasma to treat these patients?
It would seem that it's becoming one of the first choices, not necessarily the first choice, but it's become one of the frontline therapies that people look to when people end up in the hospital and start to develop problems breathing. There's probably thousands plus of these units being given each day.
And with the increased usage, is the FDA concerned that the demand could outpace the supply?
We're very concerned at the moment because right now we're on a very steep increase in the number of cases. We were in a problem with supply previously back in April, but now that the number of cases are surging again, we're pretty worried that we're going to get into a problem with supply because the demand is going to increase. We've seen in the past week, we've seen a dramatic increase in demand. We've seen a dramatic increase in the number of hospitals requesting plasma. So we're suspecting that convalescent plasma is going to become in short supply if we don't have more donors come out.
There are some reports out there regarding the need for the government wanting to maybe stockpile convalescent plasma. Should we be concerned when we hear something like that, and why would they want to do that?
So the idea there is, while we have people with the antibodies circulating at high levels, to take some of that plasma and put it away for the rainy day when we might need it in the fall. That probably right now is not very realistic because there's not a rainy day in the fall. There's a thunderstorm pouring right now, and we need to use it right now. So right now the focus is we need people to come out and donate because the need keeps escalating right now.
When this first started in April and we were using convalescent plasma became available, you had this image of people who were in critical condition on a ventilator who needed this convalescent plasma as maybe like that last-ditch effort to try to help and save them. But now we're seeing that it's being used earlier on. Why is that?
That preliminary evidence that's waiting to be confirmed by more data, seem to show that the earlier you give the convalescent plasma, the more you help people, the more people you keep off of progressing to ventilators.
And it's hopefully to get them to heal faster and to prevent the use of that ventilator.
One of the main ways it works is by providing those protective antibodies that help clear the virus from the body. So if you clear the virus before the virus has a chance to hurt organs like the kidney or others, the idea is you prevent the damage to their body and people will get better more quickly.
What is your call to action to people who have recovered from the coronavirus to donate their plasma?
This is something that somebody can do who's had coronavirus. People are often very grateful for the care they've received. They want to do something to give back. So if you've had coronavirus and you've gotten better from it, one of the things that you can do, pretty simple, pretty easy to give back, is to go donate convalescent plasma. It's not a difficult thing to do. It makes a big difference. And people on the other end who are receiving it, their lives may be saved.